Hi everybody, welcome to my channel. My name is Kasia and I'm currently traveling solo with an 8 months old baby. So I think while traveling it's very important healthcare and if something happened actually for medical reason, especially with a baby, because when I was traveling alone it was never such a concern as with a baby. So actually yesterday the baby girl rolled out of the bed, which is quite high. Just look, so she rolled out there. So I was worried at the beginning because after the drop, when I took her in my arms, she was kind of like rolling eyes and opening and closing and kind of like falling asleep, so I thought she might have concussion. It lasted maybe 5 minutes, then she just cried, so there was some kind of distress, so I thought maybe she's in pain or shocked, but it's still worth checking. So she was crying like for maybe 30 minutes on and off. So I continued thinking that there was a distress, so I just really wanted to check that. So I went to hotel reception, asked them if there is an option for like a medical consultation, so they kind of reassure me should I go to hospital or everything is fine. So they have doctor on call, which is chargeable. I asked for pediatrician, but the pediatrician says that for infants it's best to go to hospital ASAP. So we did. Initially wanted to take a taxi, but hotel kindly offered ambulance, which in some countries also chargeable, but there is the safety because the ambulance checks the main health functions, so like oxygen levels, blood pressure, I think the pulse as well. So yeah, they just and they look also at the eye, into the eyes with the light. They check the main function, whether the brain is functioning, and so on and so on. So I thought it was a good idea. We're waiting, I think, 15 minutes for the ambulance, so we would be faster with a taxi probably. However, I think it was still good because it was more reassuring. Plus, because I'm new, we're not at home, so I wouldn't know where to go, how to behave in the hospital, and so on. So it was very helpful because the care team from the ambulance just took us to the appropriate person. We were admitted very sorry for that. We were admitted very quickly, checked very quickly, and it was a very smooth process. So the consultant said that after looking after her again, he said she was fine. So he said he did similar checks to the ambulance people. It was just basic checks, so like whether she reacts to lights, she responds as a healthy baby. They didn't do a CT scan because at this age it's very risky and the risk actually exceeds benefits. He gave me checklist because if she had concussion, the symptoms would get worse with time. So I will share the checklist with you, but also I wanted to discuss when you're traveling, what's important actually. We're singing, yeah? It's a bit bored, so it won't be long video. Okay, so she said this. She's getting at the stage that she loves phones, so she just wants to grab everything I'm holding and the phone. Okay, so in terms of medical care when you're abroad and something happens, it's good to have travel insurance, check terms and conditions because it's very important, terms and conditions. Whether, for example, they accept all hospitals, whether there is a list of hospitals you need to authorize before. So this is important because it saves a lot of hassle. Then there is possibility of healthcare, private healthcare. So for example, if you're insured in UK, it's possible that it includes global hospitals as well, but you need to check that with your provider. that's an option. Sometimes they supply it with from the employer. There is also a free option of European or global health card, which is available for all UK residents from what I know, and it's free of charge. And it usually works within Europe. So when you're traveling and in the country that you're traveling to, there is a free healthcare. You're also entitled with the card to the free healthcare, so it's really good to have it. Yes, so these are the main points I want to consider, and let me share the checklist with you. One more thing. So the passport is mandatory when you're going to hospital abroad, most of the time, I think. Okay, so here's the checklist. So this is what I got from the doctor, and we're supposed to monitor her for 24 hours for drowsiness or increasing difficulty in awakening patient, awaken every 2 hours during the period of sleep. Yeah, she sleeps very poorly anyway, so she wakes up every sometimes to 2 hours if I'm lucky. So no problem with that. Nausea or vomiting, convulsion or fits, bleeding or watery drainage from the nose or ear, bleeding or watery drainage from the severe headache, weakness or loss of feeling in the arm or leg, confusion or strange behavior, one pupil, black part of the eye, much larger than the other, peculiar movement of the eyes, double vision or other visual disturbances, a very slow or very rapid pulse, or unusual breathing pattern. Yeah, so this is if that sign us something very seriously gone on, and then we need to go to hospital to emergency. Okay, so thank you for watching. I hope you won't ever need to go to hospital in a foreign country with your baby or yourself. And thank you for watching. Have a nice day. Bye!